Hi, everybody, and welcome to our first episode of Memory Matters, a show that explores the science behind memory care. I'm Ollie, and I'm one of the co-founders of Lizzy Care.
And I'm Sarah, the other co-founder of Lizzy Care. And this podcast is brought to you on behalf of Lizzy Care. Lizzy Care is a solution that has been designed to support and enable families and their loved ones who are going through the journey of dementia. We're memory care that is crafted by science and delivered with love.
And what that means is that we've created a solution that makes taking care of a person with dementia that little bit easier for families. We're helping families find out about the latest research that is involved in memory care. We are making sure that families get a comprehensive plan of care in place for their loved one. And then we're connecting families to the vital support services that they need. There's been a lot of advancements in the memory care space, like improved medications, the role of diet, how physical exercise can impact care. And most families aren't aware and don't have access to kind of trawl through the depth of research that's involved.
So in each episode, we'll be talking with experts about the work they're doing to improve dementia care, whether that's one of the latest medications, or with our first podcast here, we're going to be talking about how diet might improve our brain health.
Yeah, and in this first episode, we're interviewing Dr. Russell Swerdlow, who is the director of the Alzheimer's Disease Research Center at the University of Kansas. And he is a pioneer in brain energy metabolism. One of the things he's really focused on is the role of the ketogenic diet and how using the keto diet or a modified version of the keto diet might actually slow down cognitive decline for people who have Alzheimer's.
Oh, so that's a really different take on what most people use the keto diet for, which is obviously to lose weight.
Absolutely. And so this episode with Dr. Swerdlow is really going to explore how diet has an impact on the brain, and then specifically how it's playing into dementia and Alzheimer's and the impact on those conditions.
And I think this is going to be particularly useful for our listeners who are trying to do their best by feeding their loved ones the right food. And sometimes it's hard. You know, what is the right food?
So we are really thrilled to be introducing Dr. Swerdlow as our first guest on Memory Matters. Here's the interview. Dr. Swerdlow, welcome to our first episode of Memory Matters. How are you doing today?
I'm doing well, Ollie. How are you?
I'm great. Thanks for asking. We thought we'd start by just asking you a little bit about yourself and what you do. So are you able to give us a bit of background?
Sure. I am a physician scientist and I am a cognitive neurologist. I also perform research on Alzheimer's disease. Alzheimer's disease is my main interest clinically, and for the past 25 to 30 years, I've been seeing patients in a memory disorders clinic, and I'm the director of the University of Kansas Alzheimer's Disease Research Center.
And some of your research is focused around a version of the ketogenic diet, which most people know as the keto diet. Can you tell us a little bit about that?
Yeah, so my research focuses on energy metabolism in Alzheimer's disease, why it develops, what are the consequences of this, and how to manipulate it for therapeutic purposes. And one of the ways that we've long considered as a way to manipulate brain energy metabolism is the ketogenic diet, a very low carbohydrate diet in which the reduction in carbohydrate calories is made up for by increasing the amount of fat intake. A ketogenic diet is used in some cases to lose weight. So it's a very low carbohydrate, high fat diet, and this has some interesting properties. It changes the fuel that the brain runs off of, and that changes brain energy metabolism. And we're interested in seeing how this manipulation affects people with memory problems such as Alzheimer's or mild cognitive impairment.
And I'm really interested in that. What is your hypothesis there then, in layman's terms, if you can explain that?
The idea is that normally brain energy metabolism is being fueled through consumption of sugar in the brain. So if we could boost energy metabolism by putting another fuel into the generator, such as ketone bodies, which are generated during ketogenic diets and which make a very nice energy source for neurons in the brain, would that boost energy levels in the brain?
Hmm.
And ketogenic diets or changing energy metabolism can have a number of other effects on brain physiology, including inflammation and maybe even protein clumping in the brain.
Can you give us a couple of examples of the kinds of foods that are in the keto diet?
So certainly you want to limit any food that has a substantial amount of sugar in it. It doesn't mean you can't have any sugar or any carbohydrate, but you want to limit it. So you may be able to have some fruit, but in limited amounts. Obviously, you're not going to be eating things with a lot of sugar in them, like regular cakes or cookies or ice cream, but you can eat ice cream or cakes or cookies that are formulated to be consistent with a ketogenic diet in which the amount of sugar has been reduced or replaced. There are lots of ways to increase fats.
Does the brain differentiate between what we know as good fats and bad fats? And does that impact what the diet would include?
If we assume that the separation between the blood and the brain is intact, then good fat, bad fat may not have that much of an impact on the brain, because what gets into the brain are the smaller pieces of carbon that have already been broken down from fats. But good fat, bad fat is still a very relevant issue, because outside the brain, good fat, bad fat can have a big effect. For example, if we eat too much bad fat, that can have adverse effects on cholesterol or perhaps even cardiovascular health over the long term, whereas eating healthier fats may help avoid some of those potential problems.
And I think that's a really good point as well, because we often hear about a single disease, and the fact that you're looking at this as a holistic approach to the patient is really a helpful way of looking at that and considering everything.
Yeah, if you're going to try any kind of therapeutic intervention, we want to try and minimize any of the downsides while maximizing all the potential upsides. Certainly, we can minimize downsides by trying to control the quality of the fats that are being consumed. I'm not going to place aspersions on any kind of fat. People can do that themselves, but one can increase their fats by, let's say, just eating bacon all day, or one can increase their fat by eating avocados all day. So obviously, we wouldn't lump avocados and bacon into the same category. But you know what? I really love bacon and avocado sandwiches. I guess I just need to figure out a ketogenic bread, and those are available as well.
Getting the best of both worlds there.
I think that might be, the ultimate food, a nice bacon, lettuce, and avocado on a ketogenic bread sandwich with mayonnaise.
You heard that here first, straight from the doctor's mouth.
You have a study running at the moment. Can you talk to us about what that study is evaluating and maybe share some of the results that you found along the way?
We are actually studying the impact of a ketogenic diet in people with Alzheimer's disease. We performed an exploratory study of a ketogenic diet in Alzheimer's disease patients, which we published a number of years ago. And in that study, we found that of 10 people that were on a ketogenic diet for 3 months, in most of those people, not all, but most of those people, there was better performance on cognitive testing after 3 months on the diet than there was at the beginning when people entered the study. Since then, we've entered into a much larger study in which we're studying more people, and the people that enter the study who have Alzheimer's disease are being randomized to different diet patterns. And this will tell us whether one diet pattern has effects on memory performance or other cognitive performance that we may not be seeing with the other diets. And through this, we're hoping to get more information on, can we benefit memory and other aspects of cognition by recommending what people eat.
So this is kind of an amazing finding for you, right? Where people that participated in this early study and used this keto diet actually had improved cognition after a period of time on the diet. Based on that, would you recommend that people who have Alzheimer's consider switching to a keto diet?
Yeah, that's a good question. So I personally feel I have to be very careful about the recommendations that I make to my patients or the people who see me in the clinic. Certainly, I recognize that there are a lot of things that we've heard about over the years that are said or claimed to benefit cognition. And when people ask me, should I try this or should I try that? Sometimes I have to be honest and tell them that the answer is, I don't know. I don't think the field really knows. I can tell them what the data are in favor of an idea. But if someone tells me that they want to do a ketogenic diet, I think it's fine for them to try. I don't come out and say, hey, you need to do this. But that's what I'm hoping to find out. I'm hoping one day to get to that point where I could tell them this is clearly the right thing to do or clearly not the right thing to do.
Let's move on, if we may, and just ask a little bit about other diets. Dr. Swerdlow, we hear a lot about the Mediterranean diet and that's efficacy for people with dementia. Do you have any view on that?
The Mediterranean diet for use in Alzheimer's prevention. Certainly, there is a lot of interest in that. That idea has been evaluated through a number of epidemiology studies, looking at different populations and what do they eat and what are their risks of getting Alzheimer's disease. And in a number of those studies, it looks like populations that have this Mediterranean diet pattern have a lower incidence or prevalence of Alzheimer's disease, which has caused some to speculate that maybe that dietary pattern can be protective for the brain, or at least less harmful than other diet patterns. There's still a lot of work to be done to see how effective it actually is in a clinical trial. But for now, while those trials are being done, some doctors may recommend a Mediterranean diet to people who are interested in long-term brain health.
We read a lot of articles, about the benefits of eating blueberries or drinking green tea for people with dementia. Are they really beneficial? Is there some science behind that?
Well, there certainly is science behind it, and I try to put that science in perspective. There are studies of some of these compounds that have been done in animals such as mice, where, sure, studies can demonstrate certain upsides to high levels, let's say, of components like green tea or blueberries. How well that translates into people trying to do it on a daily basis is a little more unsure, but there tends to be some literature on many of these things. And if you look at the literature, the pattern often is small studies that show maybe a small potential impact. Now, whether that impact is going to hold up on larger, more rigorous studies remains to be seen. So people can do their own experimentation if they like, as long as it seems safe and reasonable and they're not hurting themselves.
Well, caregivers are quite frequently overburdened, and asking them to change how they might cook or prepare food for their loved one is a challenge. How might we help them?
This is a real issue, especially if you have one spouse who's cooking for another spouse with a dementia. The spouse who's taking care of the person with dementia may already have burdens on them through providing care, and asking them to implement a particular diet can be seen as increasing that burden. So it has to be done in a way where the person who's controlling the meals or preparing the food is comfortable doing it. The person with the memory problem may not be able to remember why they're not supposed to eat certain foods and why they're being served certain foods. No one wants to be the policeman over the food or the bad guy.
Yeah.
So this could be a challenge as well. There are ways to reduce this burden. For example, by bringing in prepared meals or by using substitutes for the general snack foods that we love.
One of the behavioral things that we've seen with a lot of patients as well is they get quite fussy with their food and will not want to eat certain foods because it's a form of control as the disease progresses. For the sake of our caregivers who are working with people with different types of dementia, is there anything that you would recommend for them to be stocking their fridge with?
Oh boy. Well, that's a real tough question to field. Certainly if someone makes it through a meal where they're thinking, yeah, I'm kind of enjoying this, but I'm not really loving it, can you make a case that they should be able to eat something that they then love as a reward for that? For a ketogenic diet, there are things like ketogenic ice cream or cookies.
I think that's a great idea. Ketogenic ice cream.
Whatever people are doing, I realize it has to be sustainable, because if people really don't like what they're eating, they're not going to stick with it.
Yeah.
I think a lot of people would agree that we eat a lot of sugar. I'm certainly as guilty of that as anyone. But some of the epidemiology studies, whether it's Mediterranean diet or other small studies like ketogenic diet, point to the potential benefits of reducing sugar intake.
And lower salt is another key takeaway, I think, from a diet perspective.
Lower salt has been incorporated into other types of diets that are being looked at to treat people with memory disorders. There's a diet called the DASH diet and a diet called the MIND diet. The DASH diet limits salt with the intent of trying to minimize hypertension, high blood pressure. And the MIND diet takes aspects of that DASH diet, that low salt, anti-hypertensive diet, and combines it with components of a Mediterranean diet to define a diet that is hoped that can benefit brain health, although the studies on that subject as to how much it benefits brain health are currently mixed.
And can I just ask a little bit more on that research? Have you been able to measure differences at different stages of the disease? Is it more effective at the beginning of the disease, or does it make a difference if somebody is quite progressed with the illness?
The question of whether a diet intervention would likely work better early on in the course of a disease or in the prevention stage or in the later stage, we don't really know. In general, people in the Alzheimer's field tend to think that the earlier that something is initiated to help, the more effective it's going to be. In other words, best to try and save things before they break down too bad, because we might not be able to rebuild them all that well once they have broken down. There's very possibly a lot of validity to that. But ideally, I would like to think that some of these diet patterns may be able to have an impact on the brain at any stage. So I guess it comes down to what's really driving a disease like Alzheimer's disease. If the intervention that we're trying is sort of hitting the edges of the disease, it may not have a large impact, or to have any impact at all. It may only be useful at a certain stage. But if something is really hitting pathology that's at the heart of the disease, I'd like to think that it could be beneficial at any stage of the disease.
I think that's a really exciting and positive way for us to be looking at things with diet.
Absolutely.
So the message is eat healthy.
The message is eat healthy, and if you're trying to adopt a particular dietary pattern for brain health, do it to the best of your ability. Because for some diets, if you don't do it adequately, it may be on the level ultimately of not doing it at all.
Thank you for that.
Let me try and squeeze in one last question. Your trial, are you still looking for participants?
Oh, boy, that's a good, thanks for bringing that up. Yes, we're still enrolling participants into our trial. It's called the Therapeutic Diets in Alzheimer's Disease Trial. And it's not been an easy study to enroll patients into.
Why has it been so hard to get people to enroll in this trial?
Oh, well, for a while, it was hard because of the COVID pandemic. This affected enrollment across a whole array of clinical trials. But a clinical trial that's focused around diet is asking people to implement a lifestyle change. And, some people are very enthusiastic about that. If they think that there's some potential for that lifestyle change to have a beneficial impact. But other people are less interested in altering their lifestyle, and certainly as important a lifestyle component as the diet.
I think traditionally people have figured, oh, well, there's nothing that can be done, so why take away that pleasure?
I suppose another aspect too is that a trial like ours is competing with trials of drugs. And there are a lot of people in this country who put a lot of faith in medications. And obviously, those people, when presented a choice between a study of a potential drug or a diet, are going to go with the drug. There are, though, people who are more interested in diet than trying an investigational drug, and may see it as a very safe way to maybe help their memory in a more natural way. And, I think maybe the sense is that a medicine has got to be more beneficial than perhaps a change in diet. But I don't know about that. I wouldn't be surprised if we found that something like a ketogenic diet actually had a bigger beneficial impact than some of the high-profile, expensive drugs that we're hearing so much about these days.
Yeah, what an amazing statement that maybe diet can be more powerful than the recent advancements in pharmaceuticals that we've heard so much about recently.
Yeah, it's not just about popping a pill.
Okay, here it comes. If there's anyone out there who would be interested in determining whether they would be a good fit for the study, then certainly speak to Ollie or Sarah, and they could help arrange a meeting with us so that we can talk more about it. It would involve maybe a couple of trips to Kansas City, but it's a nice place in the fall.
Absolutely.
That's amazing.
Yeah. Great. We'll make sure that if anybody out there is interested, you get in touch with us, and we'll make sure to connect you with Dr. Swerdlow. Well, thank you so much, Dr. Swerdlow. It's been fantastic to have you on our podcast. Really appreciate your time.
We certainly do. Thank you.
It was my pleasure. Thank you so much.
Wow. I think we just learned so much from Dr. Swerdlow. And what's astounding is that 100 years after we first found out about Alzheimer's, there is still so much research that needs to be done to truly understand this disease.
But I think there's a bit of hope there, a lot of hope, in fact. I think Dr. Swerdlow's research is pointing towards the fact that there could be a way to slow down the progression of the disease. I was particularly heartened to hear that he suggested that we could use this diet at any point in the disease progress, not just at the beginning.
Yeah. One key takeaway is that making decisions about diet is something that can be made for the person who has dementia without the need for big medical intervention, but a simple act and choice by the caregiver to look at some of these keto foods that Dr. Swerdlow mentioned and just try them out and see if you can see a difference in the care of your loved one.
Anecdotally, we have been working with a client who's been on the keto diet, and we've seen what we think are some changes. Nothing conclusive. We're not in a clinical setting, but there have been some increased upticks in engagement.
One of the things that I found so compelling about what Dr. Swerdlow told us was that he wouldn't be surprised to find that diet has more of a role and more of an effect in the improvement of dementia care than many of these new medications that we're hearing so much about in the press.
Wouldn't that be something?
It would be amazing. So thank you for listening, everybody. Memory Matters is brought to you by Lizzy Care. It's hosted by me, Ollie Fielding.
And me, Sarah Gorenstein. Our producer is Mia Sullivan. If you like this episode, please follow us on your favorite listening app and consider leaving us a review or rating. It'll help people find our show.
And if you're interested in seeing whether you or a loved one might be a good fit for Dr. Swerdlow's diet and Alzheimer's clinical trial, please reach out to us on 1-234-567-9449. That's 1-234-567-9449. Or you can email us at info@hilizzy.com, HILIZZY.com.
And we will be sure to put you in touch with Dr. Swerdlow. Take care, everybody.